Food as medicine for diabetics. Welcome to today's episode, where we'll explore how food can serve as medicine for diabetics. Managing diabetes involves more than just medication. Diet plays a crucial role. Let's dive into how specific foods and dietary practices can make a significant difference. Understanding diabetes and diet. Diabetes comes in two main forms, type 1 and type 2. Managing diabetes through diet means maintaining blood sugar levels within a target range, focusing on low glycemic index foods, fiber, lean protein, and healthy fats. The role of fiber. Fiber slows sugar absorption, preventing blood sugar spikes. Soluble fiber, found in oats, legumes, apples, and carrots, slows digestion, helps control blood sugar, and promotes fullness, aiding in weight management. Power of protein. Protein stabilizes blood sugar by slowing carbohydrate absorption. It supports muscle repair and growth, crucial for diabetics. Great sources include fish, chicken, tofu, legumes, and low-fat dairy. Healthy fats for diabetes management. Unsaturated fats, especially omega-3s found in fatty fish, flax seeds, chia seeds, and walnuts, have anti-inflammatory properties and support heart health, improving insulin sensitivity. Superfoods for diabetics. Let's look at some superfoods beneficial for managing diabetes. Berries. Blueberries, strawberries, and raspberries are rich in antioxidants, vitamins, and fiber. They have a low glycemic index and help control blood sugar while satisfying sweet cravings. Leafy greens. Spinach, kale, and Swiss chard are low in calories and carbs but high in fiber, vitamins, and minerals, aiding in blood sugar management. Nuts and seeds. Almonds, walnuts, chia seeds, and flax seeds provide healthy fats, protein, and fiber, helping maintain stable blood sugar levels. Whole grains. Whole grains like quinoa, brown rice, and oats offer fiber, vitamins, and minerals essential for blood sugar control. Legumes. Beans, lentils, and chickpeas are excellent sources of plant-based protein, fiber, and complex carbs, stabilizing blood sugar levels. The impact of glycemic index. The glycemic index ranks foods based on how they affect blood sugar levels. Diabetics should choose low GI foods like non-starchy vegetables, most fruits, legumes, and whole grains to avoid sharp blood sugar spikes. Meal planning and portion control. Effective diabetes management involves meal planning and portion control. Here are some tips. Balanced meals. Aim for a plate with half non-starchy vegetables, a quarter lean protein, and a quarter whole grains or starchy vegetables to maintain steady blood sugar levels. Regular eating schedule. Eating at regular intervals helps keep blood sugar levels consistent. Avoid skipping meals to prevent harmful spikes and drops. Portion sizes. Be mindful of portion sizes, especially for carbs. Use smaller plates, measure portions, and avoid second helpings to manage calorie intake and blood sugar levels. Hydration. Staying hydrated is crucial, as dehydration can affect blood sugar levels. Water is the best choice, but herbal teas and low-calorie beverages are also good options. The Mediterranean diet. The Mediterranean diet, rich in fruits, vegetables, whole grains, lean protein, and healthy fats, emphasizes whole, unprocessed foods. It improves blood sugar control and reduces cardiovascular risk, making it highly recommended for diabetics. Conclusion. For diabetics, let food be thy medicine, holds significant truth. A well-planned diet can manage blood sugar levels, reduce complications, and improve overall well-being. Focus on nutrient-dense, low GI foods, incorporate fiber, lean proteins, and healthy fats, and practice mindful eating. Always work with healthcare professionals to tailor dietary choices to individual health needs. Thank you for joining us, and remember, your food choices can be powerful medicine. Until next time, stay healthy and eat well.